Everyone knows it's important to make a good impression on a job interview, but besides retooling your resume, there are some things that you can do to give yourself a little bit of an edge over the competition. Joining me this morning is Dr. Stanislaw, who is a plastic surgeon, and his patient, Sharon Mickelbus. Thank you both so much for being with us. Dr. Stanislaw, first, have you seen an increase in your patients coming in and telling you about this concern that they feel like they do need a little bit of an edge physically?
It's one of the top three. I mean, right now, I have a tremendous number of patients who have been out of work for over a year. They're trying to compete against a younger workforce.
Right.
And it's two aspects. A, when they interview you, they can't ask your age. It's against the law to ask someone's age. So they're going to judge you just by looking at you.
By your appearance.
By your appearance. So that's a big thing. Also, it's self-confidence. If someone's concerned about how they look, their teeth, their wrinkles, or something like that, they're not going to project as well. They're not going to look in the person's eyes. So it's really being able to connect and look in their eyes.
Right. Definitely. When you feel good, when you know you look good, you definitely present a stronger personality, and you really kind of just
more confident.
Exactly. Exactly. Is that what you were feeling when you went to go to see Dr. Stanislaw?
Oh, absolutely. That the job market is such that there are hundreds of people now looking for the positions that used to be perhaps a dozen. And in that competition, I'm 53. You know, that doesn't look so good on paper if they do, you know, find that out, but I've got the energy of someone a whole lot younger, and I want to present that way.
Now, you and Dr. Stanislaw talked about the options available.
Yes.
And you've decided to go with a liquid facelift. Is that correct?
That's one of the possibilities,
okay.
Actually. I have an interview coming up on Friday, and I definitely am concerned about the eyes and
nasolabial folds.
Yeah.
So tell us about the liquid facelift.
Well, basically, in today's day and age, you have two options. You have a surgical intervention, which, you know, unless you have the finances to do that during the downtime of being unemployed,
right.
But a lot of people don't have those finances, so a lot of people opt for more of the non-surgical interventions like Botox, Dysport, facial fillers, Juvederm, Restylane, Perlane. So those are all focal volumizers that we can do for these are called nasolabial folds, so we can inject the nasolabial folds. The little lines above the upper white lip, you can inject those. For under the eyes, a lot of people have what we call tear trough deformity, so it makes them look older. When people look at you, they want to look at your eyes. And anything that distracts them from looking at your eyes is unaesthetically pleasing. So the better we rejuvenate around your eyys, the best bang for your buck.
Okay, so all those things.
All are injections. The biggest risk is a bruise, so that bruise might last about 7 days if you're unlucky. And
the cost for those procedures is significantly lower than going for a full-blown facelift.
And what's nice is today the fillers that we have are a lot longer lasting, so anywhere from 6 months to 2 years. So a lot of the products have come a long way.
We'll go over some of the prices for those procedures.
From the Botox and the Dysports, those are the ones that stop the muscles from contracting, like for the glabella or the forehead or the crow's feet. Generally, depending on how much product that you need, can range anywhere from $200 to $600 depending on the volume that you need. For the injectable fillers, again, it depends on how much volume. The older the person, the more hollowed out they are, the more product they need, so it may get up there a little bit. Those products, generally, they're not inexpensive. I mean, they sort of start around $600 and then go up from there. But
and for most people, it does make a significant difference. We have some before and after pictures that we can show, and you can sort of walk us through what we're looking at here.
So this is Mary, and basically she had what's a true liquid facelift. That was with Sculptra. She's also had some focal fillers for under her eyes, and basically she didn't want to do any surgery. So what
did she have done?
The Sculptra, which was an injection every 2 months until we got to a point where she was volumized enough. She had Restylane under her eyes for her tear troughs, which basically is instantaneous. You put it in, you see the results right away. And both of those helped a lot in just making her softer, to being able to look at her eyes and get rid of the shadows.
Sharon, are you comfortable with moving forward with some of these procedures?
Oh, absolutely.
Yeah. All right, well, just real quickly, why don't we go over the I suppose. You hear these horror stories of doctors who aren't qualified to perform these procedures, dentists even who are performing Botox. What do people really need to be aware of and look out for when they're looking for a physician if they are interested in these procedures?
You need to make sure that the person who's doing it is board certified in either I'm a facial plastic surgeon, dermatologists are trained, and general plastic surgeons are trained. So all three of those are trained in facial aesthetics. So those are the people that know how to administer the injections, or if you have a complication or something, are able to take care of it. So you really want to make sure that they're board certified in that. A lot of people say, I'm board certified. The question is, what are they board certified in? You have to go that extra step and ask those questions. You want to do something, like I do all my injections myself, so I don't have a nurse injector. It just has to do with experience. I find that it's much more, I like doing injections because it's an art to me. It's sort of molding and shaping it, and it's not something that, you know, some people say, oh, you could train a monkey to do injection. And that's so untrue, because that's all the horror stories. That's when people come and say, oh, look at that person on TV, they've got big lips or their cheeks are too big.
Right. You don't want to take chances with these things. You want to do your research and make sure you're thorough.
Correct.
Dr. Stanislaw, thanks so much for being with us. Sharon, thank you and good luck.
Thank you.